stroke. This show is brought to you by Kolender Medical. I'm your host, AnnMarie Cronin, and we are going to hear from Dr. Kolender about his unique personalized concierge practice and his plan for revolutionizing healthcare. His vision focuses on preventing the events that lead to all the catastrophic diseases of our time. Dr. Kolender will explain to us about how and why we develop chronic systemic disease and the course we ought to take to prevent it. To find out more about how to avoid diabetes, Alzheimer's, heart attack, and stroke, stay tuned and we'll be right back after this short break. Welcome to another edition of the Kolender Medical Radio Show. I'm your host, AnnMarie Cronin, and we are here talking with Dr. Brian Kolender, MD, board certified in internal medicine and specialist in artery disease. Dr. Kolender is here with us explaining his personalized concierge practice and the model of the relationship you ought to have with your primary care physician. He'll also tell us about the simple tests that are available and necessary, which aid to the prevention of heart attack and stroke. For more information, we encourage you to only call Dr. Kolender directly at 866 Kolender. Dr. Kolender, welcome back. As usual, your shows are always very informative. Bring us up to date on what's new in your practice.
Well, thanks, AnnMarie. I thought I'd share some stories about patients who go to, the so-called, you know, regional area specialty hospitals. People go to Cleveland Clinic, Mayo Clinic, thinking they're getting, the best possible level of care. And I will say that if you have a problem, you need a surgery, you have a heart problem, cancer, urology issue, those hospitals are the best in the world. But even those hospitals do not really understand what prevention is and do not practice it.
Well, I can imagine they wouldn't practice it. I suppose they're very well known at curing whatever ails you, but you have to be already diagnosed with something terrible enough to make you want to go to the Mayo Clinic or go to the Cleveland Clinic and leave town to be cured. That means somehow we're not doing it, not able to do it here.
Well, if my patients do need, some type of aneurysm repaired or valve surgery, then I send them to the Cleveland Clinic, because we've talked about the problems with the local area hospitals and I just won't use them anymore for those kind of surgeries. So I send them to Cleveland. I even have a patient that we're working up right now who has, a probably benign mass, but it's a very complicated mass. And I'm not using the local hospitals. So I'm sending him to Cleveland to have this kind of surgery where I know they've got their act together. I'm just not, it's only a few hours away and, let's use them when we just don't know what's going on here anymore. Again, it's not that I don't trust the surgeons. I just think that the hospitals aren't putting the surgeons in the best possible position to succeed. So that's
yeah, it all comes together. It's not just the
right.
surgery
Again,
itself. It's not the technology or the surgery. It's the aftercare. It's the whole 9 yards of the care while you're there.
Right. And actually this came up in the live show last week where I was talking about the inability of Beaumont to provide adequate monoclonal antibody services to the community because they only had a few chairs. Where they should be doing 1,000 people a day, given how many people have COVID. If the goal is to keep you out of the hospital, that's the best current way to do it. And a caller called to defend Beaumont, mentioning that the services that she received were excellent and the care that from the people there were great. And again, I'm no knock on the people working there. The nurses are phenomenal. The staff is phenomenal. It's just that the system isn't prepared anymore to serve the community. So I'm having to find other means for people to, get hospital level services.
Well, they should have certainly ramped up their act, because if monoclonal antibody treatment is the way to go with COVID, and given the consistently high number of COVID cases, it would seem that that's the one area that they would start to add on help, more help and more availability to the public. I mean, 5 chairs isn't enough.
No, not at all. So again, no knock on our local surgeons. They're great. I'm referring to them, but when it comes to having a major operation that's complicated, I don't think the hospitals are in a position to support the surgeons and their staff anymore in this area. Now, when that changes, I'm happy to, come back and bring people in. But when it comes to prevention, even places like Mayo and Cleveland just don't get it. And, we'll share some of these stories of, they seem like, I mean, they may not seem like that much, but in terms of this decision was made or that decision was made, but it reveals the lack of understanding of what it takes to keep people from having an event, of what's available for people to use to stop them from having a vascular related event, stop them from having dementia, maybe even stop you from having cancer. And so it's all there, even with prescription drugs that can be used. And that's what we're talking about, people either starting or stopping. Um, and this will be interesting for the listeners to hear, because their doctors may be starting or stopping some of these drugs unnecessarily and putting people at risk they don't know that they're in.
Well, I think if people are leaving town and going to Mayo and going to the Cleveland Clinic, they're going there because something's been diagnosed as broken and that needs to be fixed, and they feel as though they're going to get a higher quality of medical intervention there, medical care.
Well, some people just go there for an annual physical. So they'll see me for their annual physical because they want the local person, but then they want the expert, and they go to Cleveland or Mayo for their Cleveland or Mayo physical. And they do not recognize, what is considered the kitchen sink approach, that's required to keep people healthy. And, the cross, you know, the need to intertwine all the specialties in one location, meaning my office, that we need to do to make sure people stay healthy.
Well, that's interesting. Just goes to show you that if you're looking for a diagnosis and you're looking for preventative care, you don't need to leave town. Let's come back and talk about that on the other side of the break. You are listening to the Kolender Medical Radio Show. And if you're interested in finding out more about today's topic or why you ought to be engaging with a concierge practice, please only call Dr. Kolender directly at 866 Kolender. Again, that number is 866 KOLENDER. You're listening to the Kolender Medical Radio Show on News Talk 760 WJR. Ready?
Rolling. Oh, no, hold on, hold on. A lot of buttons in here. Rolling.
Welcome back to the Kolender Medical Radio Show. I'm your host, AnnMarie Cronin, and we are here talking with Dr. Brian Kolender, MD, board certified in internal medicine and specialist in artery disease. Dr. Kolender is here with us explaining his personalized concierge practice and the model of the relationship you ought to have with your primary care physician. He'll also tell us about the simple tests that are available and necessary, which aid to the prevention of heart attack and stroke. For more information, we are encouraging you to only call Dr. Kolender directly at 866 Kolender. And once again, I'm going to remind listeners of in the Sunday show to tune in Thursdays at 7 o'clock when Dr. Kolender is live, 7 p.m. and you can call in and talk to him directly. Dr. Kolender, let's come back and talk about, you're talking about your experience with patients going out of town to Mayo, to Cleveland Clinic for physicals and for diagnostic work. What else can you tell us that we need to know?
Well, I want to tell a story about how a patient who, again, sees me and also goes to Mayo Clinic for their annual physical. They like to just have the Mayo experience. And whether it's through an executive program or on their own, there's people that want to do that. So my patient goes and she's a diabetic, has some plaque, but it's subclinical to them. But to me, I'm managing it aggressively. And if you're a regular listener, you will recognize that being diabetic means that you've had insulin resistance or have insulin resistance, which is the driver of disease, the driver of inflammation that leads to diabetes and Parkinson's and heart disease and dementia. It just happens to cause diabetes in some people and dementia in others. It doesn't have to lead to diabetes to cause other chronic illnesses. So, being in my practice and knowing what she's got to do, she's done very well. And her hemoglobin A1C, which is a standard blood test used to manage the progress of a diabetic. So her hemoglobin A1C is normal, meaning an abnormal A1C is maybe in the 6.5 or higher. I shoot for normalcy, under 6.
Mm-hmm.
And sometimes A1C doesn't matter to me. If someone's arteries are happy, then I'm not that concerned about the A1C. What I mean happy is we've shrunk their intima media lining, which is a objective measurement of artery health. And we've also lowered all of the artery markers that identify artery inflammation or disease activity. So that's the position this woman is in. And she has an excellent hemoglobin A1C. She's on a medicine that manages insulin resistance, reduces risk for heart disease, and in some other studies improves risk of dementia. It's not indicated for the dementia, but there's some studies suggesting that this kind of drug, which is available by prescription, it can do those things. The Mayo Clinic endocrinologist stops the drug.
That you prescribed?
Yes. Well, they're the Mayo Clinic endocrinologist, and the patient is, has diabetes, has insulin resistance, and they're on a drug that lowers insulin resistance and has outcome benefit, meaning if you take this drug, your risk of having a heart attack goes down. Being diabetic, having insulin resistance means you have a higher risk, regardless of your A1C. So,
Well, I've got a question here before you go on to the
yeah,
next,
go ahead.
aspect of your story. What shocked me when you just said this is I'm wondering, why does a doctor at the Mayo Clinic, seeing that a patient's on a certain type of medication, not pick up the phone and call the doctor that prescribed it and say, you're the person's personal physician. Why did you describe this medication? I'm thinking about going in a different direction. I think we ought to talk about it. And this is exactly what I talk about when I ask you about the compartmentalization of medicine. And this is a classic example where one doctor at the Mayo Clinic can just simply scrub everything and say, no, you're going to go to this. And then that patient's left out to sea, not understanding, who am I supposed to listen to? I mean,
Agree.
it's actually rubbish, if you want to know. In plain English terms, it's rubbish.
And that's the real problem, is because just because they're at the Mayo Clinic, and this carries a lot of weight and clout in the impression of the patient. And they made the wrong decision. So now I have to re-educate the patient of why we're doing what we're doing and that this drug needs to be on. And the worst thing is because the drug was stopped, she may not qualify for the drug anymore. But if you kept it on, it would continue.
Okay, you see, that's another reason. That's total disregard for the care that she's already in and the town that she already lives in with the doctor that she's been going to. You are the primary care physician. this other doctor, whoever he or she is an outsider that's coming in to do a physical, upsetting the apple cart and not thinking of what the consequences are. And obviously, I need not ask, but I'm assuming the doctor didn't call you for your
Of course
input
not.
or well, again, it's rubbish. So let me be clear, rubbish.
Well, and to add, just to take home the point you're making is this doctor does not understand the concepts of prevention. Because if this doctor, an
He
endocrinologist,
doesn't understand the concept of courtesy. How about
that
that?
too,
But
that
but
too.
not only professional courtesy, but what's in the patient's best interest. Because if you're going to stop something that your doctor just gave you, I would want to know why, and I would want to certainly not be put in a position where she may not get back on the medication again.
But again, that's why we're talking about this today, is that even at Mayo Clinic, they don't understand the goal and the opportunity to prescribe a drug that has those outcomes. One of the problems with our healthcare system is that the people, you all listeners, do not have access to great drugs because you don't have the disease for which the drug is indicated, but you have the condition that leads to the disease. So having insulin resistance is the condition that leads to diabetes, but if you're not diabetic, you can't get these drugs. Well, technically, she's not diabetic anymore because she's on the drug. Now that the specialist at Mayo removed the drug, we've got to wait for her to decline to get her back on a drug of that quality. Now, in my practice, I use other drugs that are, generic, that have similar indications, but I'll admit these branded drugs are better. So the fact that she's off of it now won't qualify to get back on it until her condition deteriorates to the point that she can get qualified for it again.
Wait, who qualifies it, by the way? When you say get qualified, is that the insurance company?
Yes, you have to have a certain level of
Gosh.
disease to get a drug that saves your life. It's kind of a joke.
No, it is
I
a
mean, it
joke.
really is a joke. You have to be sick. You have to be chronically ill to get a drug to prevent you from having a chronic illness.
It's unbelievable. It's actually maudlin, this story. It's becoming
It's
absolutely maudlin. And so, I mean, feel sorry for the patient. What is the, I mean, here's a patient that's going to the Mayo Clinic thinking they're going to the best of the best, already got a great prevention doctor. And now the patient is falling into this chasm of just being lost like all of the rest of them.
I mean, I've lost patients over this, who've gone to Mayo and they come back. And I've got to tell them that the Mayo doctors don't know what they're talking about because they're not paying attention to prevention. And I don't care that the Mayo Clinic, they're in a rule, they're playing with rules that don't allow you to stop a disease from happening. They're playing with rules where you do not treat anything until you have killed an organ.
Hmm.
Even if it's Mayo Clinic, they're playing by the same rules that happen here.
Right.
And so they're failing at prevention. So now we've got to start over, re-educate this lady, find generic and alternative ways to manage her insulin resistance, and work around a problem that was started by the Mayo Clinic.
So here she was possibly thinking that she's moving forward in a treatment and she's actually taking 10 steps back, unfortunately. Let's come back and talk some more to Dr. Kolender on the other side of the break. You are listening to the Kolender Medical Radio Show, and if you're interested in finding out more about today's topic or why you ought to be engaging with a concierge practice, please only call Dr. Kolender directly at 866 Kolender. Again, that number is 866 KOLENDER. You're listening to the Kolender Medical Radio Show on News Talk 760 WJR. Is this segment 3?
And rolling.
Welcome back to the Kolender Medical Radio Show. I'm your host, AnnMarie Cronin, and we are here talking with Dr. Brian Kolender, MD, board certified in internal medicine and specialist in artery disease. Dr. Kolender is here with us explaining his personalized concierge practice and the model of the relationship you ought to have with your primary care physician. He'll also talk about the simple tests that are available and necessary, which aid to the prevention of heart attack and stroke. For more information, we're encouraging you to only call Dr. Kolender directly at 866 Kolender. And once again, please tune in to Dr. Kolender's live show Thursday at 7 p.m. following Mitch Album, where he is available to talk to directly. Dr. Kolender, you've told us a story about a patient that went to Mayo Clinic and actually started pedaling backwards in her trajectory of care. Do you have any other examples of where this happens and it's wrong?
Yeah. So again, we talked about Cleveland Clinic, where I do send patients from my practice who need surgeries because I feel comfortable sending people there if they need it. But they also do not practice prevention. So I've got a patient I've had for maybe 5 years, and we've been through a lot together. Um, on paper, he does not look good. And what that means is he's had high blood pressure. He has horrible lipids. He's had some, mild insulin resistance and a lot of, chronic musculoskeletal problems, which interfere with his ability to live the best lifestyle he can. And so what we discovered in this person, even though his lipids are terrible, LDLs, which is your bad cholesterol of, 180, 190, high triglycerides, low HDL. So a pattern of dyslipidemia. And, the knee-jerk reaction in the traditional system is to put you on a cholesterol medicine. But we went through our due diligence. And what I mean by due diligence is disease identification, screening for plaque. He has a 0 coronary artery calcium score and a totally normal carotid intima media thickness. So again, regular listeners are going to know that a CIMT ultrasound looks at the layers of the artery wall, measuring specifically for the layer where disease activity occurs. And getting this test and not having someone who understands how to interpret and do something with it is a waste of time. Just like getting a calcium score and giving it to your doctor, they don't know what to do with the information. So this person went to his annual company-sponsored Cleveland Clinic physical, and they promptly put him on a statin. And again, as you know, regular listeners will recognize that if you do not have plaque, we don't use a statin. And the flip side is if you have plaque, I generally think you should be on a statin. Again, it's not for everybody. I don't put every single patient on a statin, but if you have plaque, you should be on one. That's the determining factor. Your cholesterol number has no variance, no bearing, no say in whether you go on a statin or not. It's if you have plaque. That's the disease you're using a statin to prevent. If you don't have the disease, it doesn't matter what your cholesterol is. Don't take it.
Okay, I have to butt in here
Go,
before we
please.
go on with the story. Again, I'm shocked. The last segment we talked about a similar situation at Mayo Clinic. Now you've got another patient that goes to the Cleveland Clinic for their annual paid for by their company physical, but they're just going for a physical. And I'm still not understanding why a doctor at Cleveland Clinic can decide to put a patient of yours that you're the primary care physician. You're the person they live here, they see you, you follow up their care. They're in your practice. And this doctor can just simply start writing a prescription to treat a disease that without picking up the phone and calling you and letting you know. And then that's confusing to the patient. Where is the patient? This confusion to me, I'd be very confused. And I just think I feel sorry for these patients. And then they're going to come back to you and you're going to say, no, that's wrong.
Right.
No, but that's my point.
And Well, you've said it all along. We need the National Health Service. I think
Well,
patients
yes.
are confused that they think that every doctor has access to every other doctor's electronic health records, which is not true.
Right.
A lot of times, patients that will go get a physical at Mayo or Cleveland or other, there's companies that provide executive
Right.
physicals, just as much garbage.
Hmm.
And those results don't go to the primary, they go to the patient, and there's no follow-up.
There's no follow-up, but the patient doesn't understand why they've been moved from one, train track onto another one. They don't understand why. And why did my doctor not give me a statin? My regular doctor, why is this? Imagine how confusing this is.
It's actually dangerous
It's not, it's dangerous, but it's also confusing.
because the patient thinks they're getting an executive physical.
Well, it's
Oh,
interfering with your care.
but there's no follow-up at an
Right.
executive
Exactly.
physical. So
Exactly.
abnormal findings are ignored and there's no follow-up plan. So I've known of people who died who go to executive physicals because
Dear.
an abnormal finding was not followed up. I mean, it's the patient's responsibility a little bit also, but because this is a one and done visit, the doctor performing this executive physical doesn't feel obliged to do anything but fill out their note and say, see you later, because that's what they got paid for. They don't get paid to call you in a week or 2 weeks and go, hey, did you get this
How you
checked out?
doing? Right. Exactly.
Right. I didn't see that you saw the specialist. Why don't you call me? Let's get it done. So the kind of follow-up that I do, and I'm certain none of you get because I know that the doctor, they sent you here when you have your 5-minute physical, the doctor sends you a physical to a specialist because they don't have time to talk to you. It's a
Right.
lot easier to write a referral to every specialist under the sun, and then nobody coordinates all that stuff,
Hmm.
and nobody talks to anybody, and then a specialist refers to another specialist,
Right.
and then no one has any of those records because the referring doctor wasn't the primary care doctor. It's a mess. It's a total mess, and it's even a mess when you go to Cleveland Clinic for your executive physical because they do not understand prevention.
And they're
And
not practicing it. And the
no,
doctor that you're seeing there that's doing the physical is not a specialist in prevention.
even at Cleveland, the number one cardiology hospital in the country doesn't practice preventive cardiology the way it should be done. There's a division called preventive cardiology. It's BS.
Hmm.
It's to them preventive cardiology is, well, we did a stent. Never mind everyone
Well,
who
that's
died.
reparative.
Yeah.
That's not really preventative. That's just repairing the already broken part of your body that needs to be repaired by doing a stent. So that's
It's scary to know that there's nowhere any of you can go, you know, to one of the glorified, ivory towers of medicine and feel that you're okay. But you don't know you're okay because you went to Cleveland, you went to Mayo, and that should have been the answer. And it's far from the answer. Now, if you have a problem, something's broken, you have a tumor, you have a disease nobody can find out, go.
mhm.
That's what they're good at. There's a problem, no one can figure it out. They're great at figuring it out. They're great at operating. That's what they do. They are innovating stents and they're innovating surgeries. That's where you go to Cleveland for those things, but not for a healthy visit.
Well, certainly, I mean, obviously, you would go to a place like that in order to get fixed if something's broken, but I'm still mystified by a doctor there who's going to write a prescription to a patient that he or she, the doctor, is not going to be following up with, because then they're going to come back here, go into your practice, or go back to their own physician, and that could be a mess,
They think they're the greatest.
unfortunately. In the meantime, we're going to have to take a quick break. You are listening to the Kolender Medical Radio Show. And if you're interested in finding out more about today's topic or why you ought to be engaging with a concierge practice, please only call Dr. Kolender directly at 866 Kolender. Again, that number is 866 KOLENDER. You're listening to the Kolender Medical Radio Show on News Talk 760 WJR. Ready? Welcome back to the Kolender Medical Radio Show. I'm your host, AnnMarie Cronin, and we are here talking with Dr. Brian Kolender, MD, board certified in internal medicine and specialist in artery disease. Dr. Kolender is here with us explaining his personalized concierge practice and the model of the relationship you ought to have with your primary care physician. He'll also explain to us the simple tests that are available and necessary, which aid to the prevention of heart attack and stroke. For more information, we encourage you to only call Dr. Kolender directly at 866 Kolender. Again, that's 866 KOLENDER. Dr. Kolender, you've given us some perfect examples of patients who've gone out of state to the Mayo Clinic, to the Cleveland Clinic. It didn't work out so well because the doctors there were interfering with the patient's practice without getting back to you. First of all, do you have a good story that you want to tell us about?
Of course, sure. So, I've got a patient who came in today. I've been seeing him for a couple of years, and I'll have to admit that the first year and a half has not gone well. I'm glad he stayed with me. He was frustrated and didn't like what I was telling him. But after some time, he realized that he felt crappy enough. He didn't like what he was hearing from his specialist, that he finally decided to listen to me. And so here's a retired physician. Again, physicians are people
Oh,
too,
he's a physician? Okay.
but physicians
Well, right.
that are specialists
Yeah.
have no idea what primary care is. They're just they're like you listeners. They're not experts. They don't know any better. They are experts in their area and they don't know anything else.
Right.
So and everyone has their preconceived notions and the baggage that they bring with them, and wherever they're from. He's not born in the U.S. So he finally, after going to the endocrinologist, he's diabetic, of course. It's not going well. His A1C's high, and he finally agreed to listen to me. And I said, look, if you give me 3 weeks, do what I say for 3 weeks, you're going to feel better. And so he's a diabetic. And so what do we tell diabetics to do? And we've said it on the show. If you are diabetic, you do not metabolize sugar. So we put him on a diet with 0 sugar and some protein. And it's boring. But for diabetics, you have to think about food as fuel and not, what do I want to eat today? Because the stuff you want to eat, and I want to eat too, has sugar and fat that you do not metabolize as a diabetic. And when you eat foods you don't metabolize, you're generating injury to your system. He gave me the few weeks. I gave him some personalized workouts. Just do some things. He's a new person. 3 weeks later, he came in, a totally new person.
Wow.
Now, is it over? It's not over. But now he sees, okay, we agreed it's a boring diet, but he feels so much better. Keep doing
That it's worth putting up with the boring aspect of it for the sake of feeling much better than how he felt. I get that.
Right. Well, but people don't. You tell someone not to eat something they love. I was about to name something specific, but I hear radios being shut off. So I didn't say a specific food. But if you get told you shouldn't eat something you love because it's causing your body harm, there's people who go, I'll just die. Well, you might not die.
Right, exactly.
You might have heart failure
Right.
and you're on a machine, or you're on dialysis, or, there's fates worse than death.
Absolutely. People don't understand that.
Right.
Things could be worse than just immediate death.
And going out in a blaze of glory, it may not be a blaze of glory.
Right.
You just keel over on the toilet. There's no glamour there.
Right.
So it's, and I want to say that there were other things I asked him to do that he did not want to do, namely get a sleep study. Because as we've talked about multiple times, these undiagnosed silent killers insulin resistance, bad oral health, and sleep issues are the things that we need to, and plaque. We need to identify all of them. So we did our brain health screening. We do this very interactive brain health test. And he did very poorly on it. So I want to say, first of all, his artery markers were phenomenal. Shocking. Phenomenal. I said, well, he's on every drug under the sun. There's literally no other drugs to give him to fix his A1C. So this is an example of, the A1C is not the target. The arteries are. His artery blood work was perfect. He just did his CIMT today, so I don't know where that is yet. We'll have it in a week. But his artery markers are, frankly, some of the best markers I've ever seen on this train wreck guy. But his brain health test was terrible. He said, okay, I'll do the sleep study. He fought 2 years on it.
Wow.
The point is, I need to find all the areas that the chronic disease affects to get my patients to do what they need to do and agree.
And your patient that you're talking about is a physician?
Retired.
Well, retired or not, once a doctor,
Yeah.
always a doctor. But I mean, I'm just saying, so he knows enough about internal organs and medicine and so on. But it's interesting to hear that, trying to avoid taking the sleep study, and then eventually you got him talked into it, and he went. But he probably knew that he ought to have gone before you brought it up.
Well, I've been talking to him for a year and a half. Now, granted, I've not had that many touches with him because he's in this position. He had a stroke.
Right.
He's in this position because he doesn't take care of himself.
Right.
And he doesn't know how to take care of himself, even as a physician. So I think what I want to stress is, even in someone who's just a mess, his arteries are probably okay, but his brain is on the wrong path. We've got to look at all these possible areas to screen you for signs of injury to these different organ systems, because even though our CIMT is our top test because it's a very objective, it's a measurement. It's not a blood test that can be affected by by variables that we don't know. This one is it's a measurement, and that's what it is, and it's repeatable. So now we have a brain scan. It's not a brain scan, but it's a functional memory test that also changes with time. You get better, the number gets better. So this is prevention. He doesn't know he's got a memory problem. I don't know he's got a memory problem because I couldn't tell by talking to him. But he did really poorly on this test. And we said, all right, time to get to work on, let's do the rest of this. And he's all in. Let's go. I'm in.
And I think, tell the listeners before we run out of time the importance of the CIMT, and give us a quick synopsis of what it actually is, because everyone should get this test.
Well, it's an ultrasound. So simple technology. It takes about 15 to 20 minutes. It's inexpensive and nothing invasive, no dye, no radiation. It measures the layers of your artery wall. Again, we do get blood flow numbers, but that's not the point of it. The point of it is that we're checking the layers of your artery, which reflects your inflammation status.
And would you say that's one of the most important tests that we all should get, regardless of?
Oh, it's the most important test because it's, again, like it's an objective measure of your artery health. Everything else are numbers from blood work that you can't count on.
It's not being prescribed because it's not covered by insurance, but it's also very inexpensive.
And doctors don't know what to do with it. That's the other thing. No, like even at Mayo or Cleveland Clinic, they don't know what to do with the results.
But the important thing is that the people listening should write down CIMT and get that test to start their journey. Unfortunately, we're out of time, and that wraps it up for the Kolender Medical Radio Show on News Talk 760 WJR, sponsored by Kolender Medical. I'm your host, AnnMarie Cronin, and again, I want to thank Dr. Kolender for talking to us about taking charge of our health, being proactive, avoiding heart attack, stroke, and more importantly, what you can do to halt or reverse the process of chronic degenerative disease. It's never too late to start. For more information on today's show, or to learn more about how you can engage with a personal primary care concierge practice, you can call Kolender Medical directly at 866 Kolender. Again, that's 866-KOLENDER. We hope you enjoyed the show and that you've become more aware of your options in preventing and reversing disease. Once again, you can reach out to Kolender Medical at 866-Kolender, and thank you for listening.